Cystic fibrosis is a complex multisystem disorder characterized by more than 350 mutations of the cystic fibrosis transmembrane conductance regulator gene, out of over 2,000 variants. The following slides will explore the fundamental pathophysiology of cystic fibrosis and its associated complications, treatments, and pharmacology. Cystic fibrosis affects the respiratory tract in the following ways. The CFTR gene codes for the CFTR protein, a chloride channel found in the various epithelial tissues of the lung. This channel uses adenosine triphosphate, or ATP, to move chloride ions against their concentration gradient. In the airways, CFTR is located on the airways epithelial cells and submucosal glands. When CFTR is defective, it disrupts chloride ion transport and impairs sodium reabsorption, leading to the reduced water content in secretions. Consequently, the airway surface liquid decreases. Airway surface liquid is crucial for the mucociliary escalator, which, when effective, moves mucus and any foreign particles upwards towards the upper airway, away from the alveoli. This is when a cough will expel the mucus from the airway. Patients with cystic fibrosis have impaired ability to do this. Air surface liquid has essential immunological function. A reduction in airway clearance hinders effective mucus and foreign particle expulsion, leading to more infections. The altered lung environment caused by these changes fosters bacterial growth, with bacteria forming biofilms that protect them from the host immune system and antibiotics. Additionally, the resulting inflammatory response will result in tissue damage. In cystic fibrosis, the pancreatic duct is often obstructed in utero, leading to permanent damage to exocrine pancreas and resulting in pancreatic insufficiency. Over time, the endocrine pancreas can also be affected, with approximately 28% of the patients over the age of 10 eventually needing treatment for cystic fibrosis-related diabetes. In the gastrointestinal tract, cystic fibrosis leads to the secretion of thick mucus in the small intestine, which causes bowel obstructions in utero, resulting in meconium ileus at birth. Additionally, in the biliary tree, cystic fibrosis can induce cholestasis in utero, potentially leading to neonatal jaundice. As patients age, similar pathological processes lead to distal intestinal obstruction syndrome, or DIOS, and cystic fibrosis-related liver disease, affecting around 14% of cystic fibrosis patients. Nearly 98% of men with cystic fibrosis are infertile due to a congenital absence of the vas deferens, the coiled tube that carries the sperm out of the testes. For women with cystic fibrosis, nutritional status is a crucial factor in the success of a pregnancy. It is recommended that pregnancy be carefully planned, as it can lead to decline in respiratory function. The clinical presentations of cystic fibrosis varies depending on the age at which symptoms appear. I will now show you a summary of typical presentations across different age groups. For neonates, meconium ileus. Approximately 10% of neonates present with abdominal distension, delayed meconium passage, and bilious vomiting in their first few days of life. Also failure to thrive and prolonged neonatal jaundice. For infants, recurrent chest infections and pancreatic insufficiency. For children, rectal prolapse, sinusitis, and nasal polyps. Presence of nasal polyps in children strongly suggests cystic fibrosis. Adolescents, pancreatic insufficiency that may lead to diabetes. Chronic lung disease, distal intestinal obstruction syndrome, gallstones, and liver cirrhosis. Pancreatic enzyme replacement therapy, or PERT, is vital for all patients with cystic fibrosis who experience pancreatic insufficiency. PERT facilitates the digestion and absorption of nutrients from food and liquids. In the absence of PERT, patients with cystic fibrosis face a significant risk in inadequate nutrient absorption, leading to poor growth and slower weight gain. Creon is the most common PERT medication taken by cystic fibrosis patients. It is a pancreatic extract made up of lipase, amylase, and protease. Comes in 5 different dose capsules of 10,000, 20,000, 25,000, 35,000, and 40,000. Creon is in the drug class digestive supplements and cholelitholytics. Creon is indicated as a pancreatic enzyme replacement therapy in patients with pancreatic exocrine insufficiency. Common conditions include cystic fibrosis, chronic pancreatitis, pancreatic surgery, gastrointestinal bypass surgery, ductal obstruction of the pancreas, and common bile duct. Administered orally, pancreatic extracts assist in the digestion of proteins, carbohydrates, and fats. Creon has been specifically formulated to combine the features of rapid homogeneous distribution with the chyme in the stomach, with resistance to inactivation by gastric acid and rapid dissolution in the alkaline pH of the duodenum. This is achieved by enteric-coated mini microspheres, which are released into the stomach. They pass in the alkaline pH of the duodenum with the food they're intended to digest, and the enteric coating dissolves to release enzymes at the appropriate site. Some nursing considerations for administering PERT for Jacob will include the following: ensuring correct dosage, timing, and formulation of the drug, monitor and evaluate drug effectiveness and any adverse effects such as altered vital signs, GI upset, BGL changes, muscle pain or spasm, skin irritation, or blurred vision. Educate Jacob on the proper use of the drug, as it has to be taken with every meal and snack. Educate Jacob's family on PERT, dosage, mechanism of action, precautions, side effects, etc. Also monitor Jacob's weight ongoing, as this may be an indication for dose changes.